The Supreme Court announced its ruling on President Biden's vaccine mandate, blocking the one for large workplaces, but allowing the vaccine requirement for workers at federally funded healthcare facilities to stand. News 5's DeLon Dillard explains why those requirements could have a big impact on Ohio hospitals.
Inside Akron Children's Hospitals, there's some staff members missing. This past Monday, the hospital placed unvaccinated employees who do not have an approved medical or religious exemption on unpaid leave.
I think we should all not come to work when we're sick, regardless of our vaccine status. I think that everybody has a right to bodily autonomy and to make an informed decision based on their own health and their own risk.
Faith Lanshi is a nurse practitioner in the hospital. She says her religious exemption was approved, but she knows others who did not receive that approval.
I think that doesn't really make sense, that some of us are approved based on our beliefs and we're allowed to continue working without the injection, and some people were not approved.
She says for that reason, after working 32 years at the hospital, she's taking an early retirement.
I feel it's the right thing to do for me. I want to stand in solidarity with people who are being suspended for their religious belief. And I believe in America, we have the right to choose.
The hospital's mandate falls in line with President Biden's federal mandate requiring all healthcare workers to be vaccinated. Thursday, after a big battle, the Supreme Court blocked the administration's vax or test requirements for businesses of 100 or more employees. But the court upheld the vaccine mandate for medical facilities that accept Medicare or Medicaid payments. Some state health leaders are worried more people like Lanshi could be headed out the door.
Our members are extremely concerned, particularly in some of the more rural parts of the state, that they could lose a lot of their staff, and they're already very short-staffed.
But the court's ruling says the mandate falls in line with keeping patients safe, saying, quote, ensuring providers take steps to avoid transmitting a deadly virus is consistent with the fundamental principle of the medical profession. First, do no harm. In Akron, DeLon Dillard, News 5.